Finance Committee will come to order. This morning we'll be discussing corporatization and consolidation in the healthcare system and the effect that it has on what American families pay and how they get their care. I have town hall meetings in all of my counties. I've had something like 1,050 of them so far. And the two challenges I hear constantly are healthcare is too expensive, and it is just frigging impossible to understand all the word salad, all the acronyms and all the confusion. So as a committee responsible for much of federal health policy, including Medicare and Medicaid, Finance Committee's got a responsibility to identify the financial incentives that lead to increased corporatization in Americans' healthcare system. It's increasingly clear these trends are increasing costs, in many cases without improving the quality of care that families and taxpayers pay for. Now, before we dive in, I'm going to take just a couple of minutes and try to sort through some of the, as I call it, word salad that is relevant here. So people are going to hear a lot about something called vertical consolidation. Vertical consolidation is when one company buys another company that operates in a different part of the healthcare supply chain. For example, if a pharmacy benefit manager owns an insurance company and a chain of pharmacies, or if an insurance company buys up primary care physician practices, that is vertical consolidation. The other side of the coin is horizontal consolidation, which occurs when one company buys another company that operates in the same part of the healthcare supply chain. Let me also say that with respect to private equity, and we're going to be talking about this as well, private equity typically entails a group of investors buying a stake in a company in order to increase its financial value by restructuring or changing the business practices of the target company. So, what we're going to do today is sort through what all this means for typical families who pay bills, and we're holding this hearing to examine whether these practices are hot-wiring our healthcare system to favor mega corporations at the expense of the patients and taxpayers. So with those terms in mind, let me touch briefly on some examples of some of the practices that I've just mentioned. A number of our colleagues on both sides of the aisle, Democratic senators, Republican senators, have been concerned about pharmaceutical benefit managers. For over 2 months, 2 months ago, the Finance Committee held a hearing that came to the overwhelming conclusion that PBM business practices are driving up the cost of prescription drugs. Since that time, Ranking Member Crapo and I and the members of this committee have been working in a bipartisan way to take on some of the key challenges facing consumers and taxpayers when it comes to the PBMs. We are going to have more to say about it in the coming weeks, and it will be bipartisan. And I'm going to put my full remarks about PBMs in the record, but I'm just going to say, as we move on to the other issues, pharmaceutical benefit managers are in a lot of ways Exhibit A for the consequences of consolidation in the healthcare system. In the 1990s, there were over 40 PBMs. In the last 2 decades, they've been slowly rolled up into mega PBMs. And today, the 3 largest PBMs now control more than 80% of claims for prescription drugs, and they are all among the top 15 largest companies. As I said, I'm going to put my full remarks in the record, but this is something that's hit my rural communities like a wrecking ball, and we're going to have to deal with it. Let me also talk briefly about healthcare costs and quality. Advocates for proposed mergers often say that they're going to lower healthcare costs due to increased efficiency. Time after time, it's simply not proven to be the case. When hospitals merge, the prices go up, not down. When insurers merge, premiums go up, not down. Quality of care is not any better with these higher costs. A deeply troubling study from last fall showed that medication adherence significantly decreased among communities of color and the elderly if they visited a primary care provider that was run by a hospital system rather than an independent physician. So the consequences of increased consolidation are just beginning to be understood, and there's going to be more to come. I will just make it clear, and again, I'm going to be talking more about this, that I'm increasingly concerned by the potential for abuse when it comes to the use of algorithms in American healthcare. There already have been numerous reports of questionable claim denials by insurance companies using technology. Trends like these are going to require vigorous oversight. Closing this morning, in terms of my opener, let me talk about private equity ownership. When a private equity firm buys out a nursing home, a physician group, a hospice agency, or any other part of healthcare, their goal is to restructure the business and sell it for a profit in a few years. The most straightforward way to do that is to increase prices and reduce costs. Not exactly a winning proposition for patients or healthcare workers. Here's an example. A private equity firm bought up Manor Care. At the time, that was the second largest healthcare provider in the country. The firm sold Manor Care's properties to a real estate company, which began charging rent to the nursing homes. These families, or these facilities, just couldn't keep up, which led to a spiral of layoffs, health code violations, and closures. Eventually, Manor Care went bankrupt, but not before thousands of Americans lost their jobs or suffered in poor living conditions. And what a surprise, something that I'm sure everybody's going to be flabbergasted by, the private equity firm made a profit on their purchase. They make profits, they move on, and there is a trail of devastation left behind. So these are a few of the examples that we are looking at. I particularly want to thank Senator Crapo. He and I have been working on these healthcare issues in a bipartisan way for years and years. We often say that this is all about increasing competition and choices. And given the fact we're spending more than $4 trillion a year on American healthcare, the American people and taxpayers deserve it. So, Senator Crapo, thank you for your cooperation on all these matters. This is another area where we can work in a bipartisan way, and I look forward to your statement.